and welcome to my home. I am Trenda and I'm currently a rehabilitation therapy assistant student at Clearview Physical Therapy, and I'm here today to discuss different tips for a common injury condition that can happen with your feet, because your feet are your foundation. And so for extra practical hours, I am going to share some tips, hopefully more than just this one if you're enjoying these types of things. And so what it is foot, heel, and ankle tips. And so for the number one thing to do would be home exercise. And so I'm just going to show you some simple things, and this will also help with plantar fasciitis, and I've actually had it, so I can relate a bit. So you can do this in your bed, you can do it seated, or you can do it standing. And all it is ankle pumps are basically point and flex. And we would learn this too if we're recovering from surgery, most especially knee and hip surgeries, but actually really all of them, because it's highly recommended because of blood clots and deep vein thrombosis. So I would recommend three sets of 10 repetitions. So, and also to think about while you're doing this is point more, point even more, flex, flex, flex even more. So point towards the ground and then bring your toes back and up. So that's ankle pumps. And then another one would be ankle circles. And make sure you do it both ways. And make sure you do it on both feet. And then inversion and eversion. So you're going to bring your toes in and then out, in and out. And you can do that with a foot flexed, or you can do it with a pointed toe too. And all of these exercises can be done in bed, seated or standing. And then this next one you can't actually do in bed, but you can do it seated too, is going through your full foot. So starting on the ball of your foot, bringing the weight down and all the way through to your heel. So you're really waking up your foot and trying to give it good energy. And then you're going to lift just your toes, which can be tricky to do, and it may be hard to start with, but try and do it. And then full foot. And if you're feeling pain at any time, just stop, okay? And then continue when you feel better, and it doesn't have to be the same day if it's a problem. So again, ball of foot through all of the foot to the heel, toes up, and then full foot. Awesome. And then also it would be really good to, if you are standing, to try and raise up so that you're on the ball of your foot, almost similar to that one. And then you're just going to come down, so you're going to bend your knees so that you can place all that weight bearing into your flat foot. And that's really good for osteoporosis and weight bearing of your bones in that case. And then the other one that I like to recommend, and it's something when we're babies, that walking is the first thing we learn. So, and we want to maintain that all of our lives. So when you are born, the doctor will take a sharp object and run it along the bottom of your foot, and it's actually to test your reflexes. And then your toes will fan out and kind of turn up. And so I recommend that as an adult you do that too, just because it gets your toes wiggling different ways. Wiggle your toes as much as you can, basically, is really super good. Tip number 2, I would recommend, if you are having pain at night, I would recommend that you put or in the morning. Usually it's more so in the morning, but you could have foot pain at night if you've had a hard day or whatever and you have inflammation. Place a water bottle in your freezer, and then the next day bring it out, and you're going to roll underneath your foot from your toes to your heel. Roll it back and forth, and that will feel super good on your feet, and then you'll be able to manage your day better if it's early in the morning, or it may help you sleep better at night. So that is also really good. Tip number 3, just for positivity and for timing, if you are doing your home exercises, is really great tunes. And so my recommendation would be the soundtrack from Happy Feet, because we're talking about feet, and actually it is a really good soundtrack. And so the only thing is with some of these exercises, because you want to go slow and through all of those muscles, ligaments, and tendons, you may want to pick a sound or a tune that's a little bit slower. But sometimes tunes, faster ones, motivate, and that's okay too. And if you're feeling like you have energy, absolutely do that, because movement is better than none. So I think that's pretty well all of my recommendations for heel, foot, and ankle pain or plantar fasciitis. And if you have any questions, please feel free to contact me or anybody at the clinic. And I just thank you for taking the time to watch this video, and I hope you enjoy it.